In a globally connected world, innovations can take flight anywhere, but the real skill lies in making life-saving innovation accessible to all. Even as we search for a COVID vaccine, there needs to be an equal amount of thought devoted to how the vaccine gets to patients. Dr. Margaret Hamburger, I know her as Peggy, former FDA commissioner, is the Foreign Secretary of the National Academy of Medicine. Great to see you. What a pleasure. This was a nice surprise when I looked and saw we would be talking again, Peggy. And I just want to ask you, something I asked Alex Azar a little while ago is to tell us, how strong or not the international dimensions of collaboration are right now when it comes to fighting COVID. He said it was pretty strong. He didn't include China, but I'm wondering if you have a different view.
Well, I think that there's been an amazing mobilization of the scientific community in response to this unfolding global pandemic, and it really has gone, across sectors and disciplinary boundaries and also borders. And that's been terrific to see. I think that when we start to move, though, from the research aspects of this challenge to the product development, which is happening very swiftly, and especially with respect to vaccine, we're seeing more sort of nationalism emerge. And there are great concerns about whether vaccines can be, in fact, developed in a coordinated, collaborative way and manufactured and distributed in a way that is equitable and, importantly, public health driven, and not just rich countries, purchasing all the available vaccine for their citizens first. And of course, we understand why governments are going to want to protect their citizens, and that's understandable, and they should. But we need to think about this as a global pandemic, and the fact that, in fact, addressing the public health challenge appropriately involves also making sure that a preventive strategy like a vaccine is made available where it is most needed to reduce the ongoing transmission and the threat.
So what are the chances of that? I mean, I just want to be candid that I do a daily coronavirus report for The Hill and interview prominent people all over the world in this. And the very first interview I did was Dr. Mark Dybul. Mark was President Bush's global AIDS ambassador, involved with the Global Fund. And he made a powerful point. He said, look, if we aren't helping to invest in the infrastructure, if we aren't caring for people in lesser developed countries who will be exposed and infected to this virus, it will come back. And so this was months ago, and it's proving to be absolutely right. And almost no one that I see is discussing it, at least not in this country. So how do we just not talk about it here and get that right? Because we've seen in Latin America an explosion of cases. We've seen an explosion of cases in the southern part of the United States. But how do we fix that and realize that their health is our health?
Yeah, well, I think we have to go back to fundamentals. We have understood for a very long time that we live in an interconnected world. And in fact, our modern world makes us very vulnerable to infectious disease threats that can arise anywhere around the world. And we've seen it happen before. We've seen H1N1, which was a pandemic flu threat in 2009 that emerged in the Americas with early cases, really being concentrated in Mexico. Of course, SARS, which in 2003, which came out of China and affected Southeast Asia and Canada most predominantly, and then Ebola in West Africa and in East Africa and Zika, and so we know that a disease in one place can in fact be in our backyard within 24 hours or so because of international travel, trade, and especially with the crowding of cities, et cetera, we are vulnerable. And so it is crucial that we think about these health threats as a safety and security issue nationally and internationally, that we attempt to put in place and support systems all around the world to rapidly identify and control these emerging infectious disease threats as close to the source as possible. And then even once we're in a situation like we find ourselves so tragically in now, where we have a global pandemic, where so many countries are being devastated in terms of health and their economies, that we recognize that the solutions are not going to come from things we do simply within our borders, because we can never close them off. We can never stop the international travel and trade and the spread of infectious microbes. And
Right.
so we do have to recognize we're all in this together, and the solutions have to be comprehensive.
Peggy, I mean, I agree with everything you're saying, and I've been tweeting so much out about today's cool forum. I think I tweeted out something about you where I said not only does she know drugs and drug pricing and approvals, but she's a big expert on transnational weapons of mass destruction. You've got different, closets in your head, but to a certain degree, a pandemic is a weapon of mass destruction. Perhaps not from a country, but it is there. And my experience, whether you're talking about nuclear issues or biological weapons or these kinds of things, is that you get a global order together. You get a convening of people together. You talk about the transnational consequences and what needs to be done to shore up all our security. Are you surprised that that really hasn't happened in this case?
Well, this is a difficult challenge. I think we first met when I was working for an organization called the Nuclear Threat Initiative, which
Sam Nunn.
I was one of the founders way back in January of 2001. And its mission was to reduce the threat of weapons of mass destruction. And many people said, well, what's a weapon of mass destruction? Back then, it was pre 9/11. But I started the biological threat program. And at the time, I said, I'll take this on, but you have to let me do naturally occurring biological threats like pandemic, as well as biological weapons and biological terrorism, because they are very interconnected in terms of the kinds of systems that we need to prevent and prepare and respond, and that Mother Nature can be a powerful terrorist as well. And it's not as easy as, none of this is easy, but nuclear threats, you have a much more concentrated target in terms of the materials for nuclear weapons and those who have access. Of course, you can get rogue actors who can remove materials and then the threat of nuclear terrorism. But advanced biology is going on in academic labs all around the world. The tools to be able to undertake the development of potential microbial agents that could be deliberately used to do harm are much more accessible, and the oversight for governance is much more complicated. So it requires a layered approach with scientists and institutions taking responsibility for the stewardship of their science. But we also do need national and international governance mechanisms to reduce the threat. And we've known this for a while, and many of us have been working hard on these issues. We need to redouble our efforts now. And frankly, whether it's deliberate or natural, we need to think about biological threats in the same way that we think about national security, national defense. And we have to invest in a sustained way at the levels necessary to do the job right. And we just simply haven't done that before.
Peggy, just in closing, I'd love to get your quick thoughts on, being the former head of the FDA, we see a race towards a vaccine or efforts to get vaccine and therapeutics. Your insights on, is there anything we're not doing that we should be doing?
Well, I think, one of the most serious concerns at present is that in our efforts to accelerate the research and development and to move swiftly to also create the necessary manufacturing capacity, because we don't want unnecessary gaps in the process that will slow the availability of this important tool to people who need it, that we don't abandon rigorous science. Because at the end of the day, a vaccine or other therapeutic will not do anyone any good if it doesn't do what it claims to do, if it isn't effective, and importantly, if it isn't safe. With a vaccine, you're giving something to people who are otherwise healthy to prevent them from getting a disease. And you want to make sure that you're not going to actually give them something that will cause harm. But we also need to know a lot about how effective the vaccine is. Do you need multiple doses? How long will protection work? So that healthcare workers and the public can understand its most appropriate use. So we have to do the science, and we can't allow political pressures or wishful thinking or all of our desire to see progress towards an important goal get in the way of really asking and answering the critical questions of, is it effective, is it safe, and is it appropriately manufactured to be of the quality that we need.
Well, I feel we're very lucky to have had any of your time today. Really appreciate your insights. Dr. Margaret Hamburg, Foreign Secretary of the National Academy of Medicine. I hope we can have you back many times. It's been great to catch up.
I'd love to. Thank you so much for having me.
Thank you.